Shall we go?
You've gone live. Yep.
Thank you. So I'd like to begin by welcoming those members of the public and press who are watching today's meeting via our live stream. There's always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed, and the public broadcast will be paused. If it's not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. I will begin by confirming the attendees at today's meeting. Councillor Holditch.
Present.
Councillor Hudson.
Present.
Councillor Fitzgerald. Okay, moving on. Dr. Liz Robin.
Present.
Wendy Oger-Welborn.
Present.
Jan Thomas.
I'm covering for Jan. Louis
Thank you.
Camphor.
Thank you, Louis. You were next on the list. Louise Mitchell.
Yes, present.
Oh, good.
Present.
Right. Val Moore.
Present.
Councillor Ray Bisbee.
Present.
And myself, Councillor Hitford. Thank you very much, everyone. We've received apologies from Charlotte Black, Service Director for Adults and Safeguarding. So any other apologies at all that I don't know about, please?
Not that I'm aware of, Chair, no.
Thank you very much. Okay. So agenda item 1, apologies for just done, absence, apologies for absence and declarations of interest. Does anyone wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? Not seeing anything. Okay. Moving on, agenda item 2, minutes of the meeting on the 7th of August 2020. We're being asked to approve the minutes of the meeting on 7th of August 2020 as an accurate record. Can anyone which you all should have had emailed to you, can anyone who does not agree with this proposal indicate this now using the raised hand function? I'm seeing no hands. Okay, I see no objections to the proposal to approve the minutes as a correct record, so we'll take that as carried. Thank you. Agenda item 3, action log. An updated action log has been included in the published papers for this meeting. All of the actions have been completed or are on the agenda for discussion today. Does anyone have any questions, or can we take that as noted? Please raise your hand if you do. No hand, so I'll move on. So no members or officers as indicated today wish to speak, so we'll take the action log as noted. Agenda item 4, the Health Protection Board report. Item 4 is the Health Protection Board report. Dr. Liz Robin, Director of Public Health, is going to give a presentation on this. Liz, welcome.
Thank you. And I'm wondering if Democratic Services is able to put the presentation up on the screen. Is that possible? Thank you.
No.
Lovely, thank you. So this is our update from the Health Protection Board, the Multi-Agency Officer Board, which meets weekly on progress with our local outbreak control plan and on recent events in relation to COVID-19. So you have a link to the plan and the roles and responsibilities on that cover slide. Moving on, please. Next slide, please. So the board reviews a number of factors that affect COVID-19 in Cambridgeshire and Peterborough. The graphs you see in front of you show the footfall into retail and recreation visits, grocery visits and workplace visits, and show how those have changed since the start of the pandemic. The red line shows retail and recreation. You can see that coming up very significantly in recent weeks. Next slide, please. This is the latest picture on UK cases, and we are all aware from the news that cases have been going up, particularly in the younger adult age groups. And as we know, new social distancing rules have been introduced. with the rule of 6 and pubs and restaurants legally required to request contact details. So we're now working in that context locally as well as nationally. Next slide, please. So nationally, we're very much seeing this increase in that green line, which is young adults aged 20 to 29. You can see that they're at the top of the graph with the highest rates. And then we have the yellow orange at 30 to 39. And also we know that 18 to 21-year-olds have high rates. We're seeing that pattern in Cambridge, where there have been rises in Cambridge. In Peterborough, we're seeing working age adults with children, but a slightly different picture with more household involvement. Next slide, please. So this is just plotting our case numbers, Cambridgeshire on the left, Peterborough on the right, and our case numbers in Peterborough at the moment are looking similar to mid-July. So you can see from that chart, we've had more of a dip recently, but coming back up to levels similar to mid-July. Moving on, please. And this graph essentially shows that in another way. The green line is Peterborough. If you look at the graph on the left, it shows incidence rates of COVID-19 since March. So you see a big peak back in April, and that we're still low compared to that peak and actually have been pretty stable over most of July and August in Peterborough. You can read the keys for the other Cambridge districts on the right-hand side. Cambridge City, you can just see on that left-hand side going up a bit recently. The graph on the right shows that much more dramatically by just looking at the sort of lower rates of COVID. You can see that Peterborough has gone up in the past 2 weeks, and that Cambridge has also gone up, although starting to come down a bit. So it's our 2 urban areas that have changed. The other districts have stayed pretty stable. Next slide, please. This map reflects that. You can see the areas in Cambridgeshire and Peterborough which have had the highest numbers of COVID-19 cases in Cambridgeshire and Peterborough, and you can see that concentration of cases in the central area of Peterborough and also in Cambridge City. Next slide, please. Looking at the trends in deaths, the graphs on the top, on the right-hand side, show deaths since the start of the pandemic, and you can see that very clear pattern of COVID-19 deaths peaking, but then falling and still being low. Next slide, please. So that's the sort of thing that we look at regularly on a daily, some things on a daily basis, some things on a weekly basis, and in the surveillance and outbreak management groups. Stepping back, I think you are all aware of the governance of our response, but just making sure that everybody is aware of all components. At the top, local outbreak engagement board, ourselves. Then we have the Health Protection Board, which is an officer board that meets weekly. We have our LRF, Local Resilience Forum Strategic Coordinating Group Executive, which meets at least weekly. We have an internal council, Test and Trace Gold, which meets 3 times a week, involving Gillian, myself, Christine and Sue. And we have a daily rhythm of our surveillance cell outbreak management team coordinating the work of our local outbreak control plan cells and rapid response teams. So that is happening all the time. That's our framework. Next slide, please. So key actions in the past month since our last meeting. We have continued our routine surveillance and outbreak management work, which is critical. We have held local incident management teams for both our urban areas that call in Public Health England expertise, and NHS England attends in Peterborough as well. So multi-agency teams that review the situation that week and give public health advice on what needs to be done. So we have those weekly in Peterborough. We also called one for Cambridge with the rising cases. That's meeting again in 2 weeks. And in Peterborough, we have a rapid response team, which meets regularly twice a week at the moment to take forward action working with communities based on the advice from the incident management team. And our districts all have rapid response teams suitable for their local area. Next slide, please. So a big focus in the past month has been education. So we are working with both Anglia Ruskin University and Cambridge University to ensure that appropriate risk assessments are in play and plans are in place for return of students. Both universities have done a huge amount of work. We are ensuring that that is absolutely integrated with our local outbreak control plan and the work of Public Health England's health protection team. So a great deal of work going on that, because clearly it is a very significant issue, particularly for Cambridge City. And a lot of work going on at the moment to provide advice and support for schools across Cambridgeshire and Peterborough, as you can imagine. And John Lewis, our Director of Education, is very personally engaged with that and has support from his team and from public health staff. Care homes, we've talked about at the previous meeting, Health and Wellbeing Board meeting, lots of work going on there. And we are continuing to support workplaces experiencing cases or outbreaks, particularly working with environmental health colleagues who are doing a lot of proactive work. And we have improved our cross-border links where outbreaks occur outside Cambridgeshire or Peterborough, but our residents work in those workplaces. Those communication chains are working well now. Next slide, please. So local enhanced contact tracing, that is happening in Peterborough as an area of concern nationally, and we are seeing extremely high success rates. I would like to congratulate our environmental health officers who are leading this and who have dogged determination to succeed, and they are actually managing to contact and take the right information from between 80 and 90% of the failed cases that have been passed on to them by the National Test and Trace system. So National Test and Trace does about 75 to 80% of the cases through their telephone contact, but the cases who otherwise would not have been contacted or would not have spoken about their close contacts, we are now actually getting that information from 80 to 90%, and that's important and very well done, and higher success rate than some other areas we're aware of. So they've implemented it really well. A lot of work going on as well on events and openings. So we have district and city level safety advisory groups which review forthcoming events. And then when those events are large or particularly risky, they call in specialist public health advice. So a lot of work going on that at the moment. Testing, we have been doing a lot of planning work for winter, but we have a current situation, as you're aware through the media, with Pillar 2 testing, the tests that are accessed by the public, and some overload on those testing facilities. And the advice to people is, if you can't get a test and you have symptoms or have been advised by a health professional that you should have a test, then keep trying. If you are going for a test because you're worried but you don't have symptoms and you haven't been advised to have a test, then the advice is don't go for a test, because we need those tests free for the people who absolutely do need them under the guidance. So that situation is very live. The particular work that we are doing at the moment, and Gillian's very much involved in this and the CCG, is looking for alternative routes to testing for our key public sector workers, to ensure that delays in testing do not result in impact on health services, schools, fire service, etc. So we're doing a local piece of work on that and our contingency plans, and getting huge amounts of collaboration around the system, which is good. And we are planning for a winter surge. So as well as dealing with the here and now, we, as you know, across the system, we are planning for a winter surge. But as a health protection board, we are really pinning down those issues, which we can work together on through that board to deliver effectively in terms of contingency planning and prevention and looking ahead. Right, I hope that was slightly quicker than normal. I think we've completed. Thank you.
No, Liz, you've done very well. I've got a couple of questions, but Val's got a hand up. So Val, would you like to come in first?
Thank you. Thank you, Liz, for a really good presentation. It's extremely informative, and you know, a champion for this information being available to people. And I'll just note that only 92 people watched our YouTube of last week at this point in time. It's just one indicator of public access to this information. But anyway, I look forward to hearing more about that in a minute. But my question is about the map, which was one of the proposals come to fruition from the last meeting to this, showing the areas of incidents. Am I right in thinking, well, the map says it excludes care homes, and I presume that means the residents testing programme. But I wonder whether it includes staff members and also staff members who work in healthcare settings, because at one point that was a separate counting exercise. I'm just wondering where we are in terms of communicating the picture in full to local people about outbreaks or cases in our patch.
Yes, that's a very good question. And the reason that we don't normally include care homes on that map is not because we want to exclude them, but because of the asymptomatic testing programme in care homes, where everybody gets tested, even if they don't have symptoms. You can get what looks like very large numbers in an area that looks like community transmission, and actually it isn't. It's that very specific screening exercise. We may pick the staff up because it depends how that is done, and sometimes that just comes back with the staff member's postcode, and in that case then they would be included. But if it's postcoded to the care home, then the staff member wouldn't be included. So it varies, to be honest. These things are never absolutely complete, but that's the reason, because you could get a very skewed picture and potentially quite a lot of alarm about community transmission, when actually it was because we do this very thorough asymptomatic screening in a care home. So the picture that you see is of the more general picture in the community.
Thank you. If I could just quickly follow up with that. I mean, the reason why I ask is the lessons learned from the earlier months in the outbreak, and now we're seeing more cases in the 20 to 29 groups. You know, what if those cases are stimulated by the workplaces that those people are active in, hospitality, bar work, and all that kind of thing. You know, I'm keen that we understand what's truly happening, if you like, in order to guide action, even though looking at the data in different ways might throw up some of the issues you've described. You know, are we using it to help us to maximum effect to understand new potential surges and things like that, and the true risk for people in their communities adjacent to healthcare or care homes, etc.
So we can tell a certain amount from the data, Val, and we can also get information from some of the national research that's been done. So certainly around the younger age group, we don't think that's just workplaces. We think it is also where people have been congregating and socialising, and that's where why some of the new rules have come in. But it's a very good question, because we need to always supplement what the data shows with what our communities are telling us. So we do that through community engagement and rapid response teams, and whenever we call a rapid response team, that has the community workers, community team involvement from that area. And in Peterborough, we're going to be doing some additional work, actually more survey work, some through voluntary sector, some through other routes, so that we can really understand and talk with individuals about risk factors and what's going on. And we found in all communities, I think, and I particularly flag Peterborough because we've done so much work, that community leaders have been fantastic and communities have been really ready to engage. And I think that reflects a longer history of joint working. But you're absolutely right, we need that intelligence.
Thank you, Liz. Thank you, Claire.
Thank you. Thank you, Liz. Peter Hudson.
Thanks, Roger. Liz, thank you. It's really, really good work as always. Thank you. You said in your report that we got 80 to 90% test and trace carried out by the environmental health officers in Peterborough, which is really good. And it's really pleasing to see environmental health officers out there enforcing what they possibly can. How are we doing in Cambridgeshire?
In Cambridgeshire, the local enhanced contact tracing hasn't started yet. And that is partly because Peterborough has higher rates, and is an area of concern. So we were actually put into that system before it was announced that it would be rolled out nationally. What's happening now with the national rollout is that it is being phased, so that they're rolling it out into the areas which the government is most concerned about. And actually Cambridgeshire is doing quite well in terms of the statistics. So we have not been a priority for that rollout yet.
Yes, okay. I get all that. I know all that. But you know, and I know, we've had some issues with track and trace in some of our establishments within Cambridgeshire, and our local environmental health officers perhaps have not been as forceful as we might like, because at the end of the day, we as an authority are responsible for the public health of Cambridgeshire. Unlike Peterborough, who have their own environmental health officers, we have to work with our partner lower tier authorities. And in the case of South Cambridgeshire District Council, which I know still hasn't had a representative at this meeting since we've started, and they're supposed to be representing the district councils. So we've sent environmental health officers to look at establishment who are not track and tracing, and the establishment. I know you're sending a letter, and I know now it's going to be legal, but are we going to be able to rely on the environmental health officers from South Cambridgeshire District Council to make sure our public health policies are carried out as we would want them to be carried out?
I think we work very collaboratively with environmental health, Peter, and we have got a report coming to Health Committee which highlights some of that work we're doing. But I think it is a really good question, because you do need, and in a sense, I will actually be looking to take a specific paper to all the district council chief execs around the future of local contact tracing, so that at that level the district councils are fully cited on this, as well as the work that's going on across environmental health in the weekly environmental health group from the district councils that is absolutely joint with public health, because I think we just need to. It's potentially a difficult time coming up. There will be many different calls on environmental health officer skills. So we absolutely need at all levels to have that careful corporate engagement and prioritisation around all the different issues that are going to be needed going forward, and the place that local enhanced contact tracing will have in that. And we need, in Peterborough already, we're looking at environmental health supervision and other officers being trained up to deliver some of that contact tracing. We're looking at the same model in Cambridgeshire, and the environmental health officers are working very well together with public health, but we also need to make sure that we take that to all levels of the organisations and ensure that we have, because there is prioritisation involved, it's not easy, and we just need to absolutely do all of that to make sure we've got exactly the right agreed plan going forward. But I would emphasise there's a huge amount of really good work going on jointly with environmental health, and we are looking forward to presenting it at the Health Committee in Cambridgeshire.
So can I just come in here, because I'm sensing a little bit of frustration here from Councillor Hudson. So
nothing new there, is there?
Liz, when you say you're going to contact the chief execs of the district councils, etc., which is so important for Cambridgeshire, so what's the time frame on us to actually have a proper system up and running? I think that's where Councillor Hudson's asking and trying to get to at the moment, because we don't seem to have one at the moment that's working as efficiently as we would like it to.
It's dependent. It's a very good question. It's dependent on two things. Firstly, the central NHS test and trace has to work differently in order for an area to do local contact tracing. So we can't implement it until we have the go-ahead from National Test and Trace that it will be implemented in Cambridgeshire. It's more resource intensive for some parts of the national system. at the moment we are not a priority on that list. So there's the national element. We've been doing a lot of work to get the model firmed up for Cambridgeshire, and that's quite well advanced. We have a model. We've successfully recruited to some contact tracers within the county council who are going to supervise. We are identifying and training staff within the county council to support, and environmental health have been working on that in each district, and we've met with each district to get those plans together. So we are at the stage, I think, where we can bring a pretty much finished product up to the chief execs and ensure that we've got that whole system sign off and prioritization on that. So we're far, I think I'm confident that when the national system is ready for us, we will be ready for the national system. But I'm happy to, I will need to get back to you on when the national system will be ready for us.
Yeah, thanks, Liz. Yeah, thanks, Roger, for that intervention. It's really useful. And yeah, exactly right, of course, as ever. My issue is, as the authority responsible for public health, we have to work with our lower tier authorities, and we need to ensure that the environmental health officers of the district councils go in there to establish pubs and clubs, particularly pubs. You may only be able to have a group of 6 in a pub, but there'll be several groups of 6 in a pub, and some pubs aren't that big, you know. And if pubs aren't track and tracing properly, and if these pubs are not ensuring social distances are taking place, then we should take the ultimate step. And our environmental health officers have to be part of that. So, I mean, we can't be slow-flaked, we can't mamby-pamby about. If they don't do it, we close you. Full stop. That's what I think. Liz will tell me I'm being too harsh, and I should be nicer.
No, I wouldn't do that, Councillor Hudson. I think it's we're seeing the rising cases, we're seeing potential links with hospitality. We do have a legal frame, if you're thinking about closure of pubs under the Coronavirus Act, we do have a legal framework with tests that we have to administer, and we have to satisfy 3 tests in order to be able to go through a process to close down an establishment. So it needs to be an imminent public health risk. There needs to be clear evidence that taking that action would reduce the risk, and it needs to be proportionate. So there's a certain amount of work that needs to be done. We try to work collaboratively with establishments so that they understand those 3 tests and try very hard not to meet them by changing what they're doing. But certainly that sanction is available, and I think there's a very clear national direction now, national political direction to in a sense go harder on enforcement. But that will be our approach. I will also be writing to all pubs and restaurants with the help of Christine's team, so that the communication is well worded. And we're just revising the letter that we had ready to incorporate the new legislation. And again, I hope that will be helpful.
It's just the only thing I'm issued with. We need to make sure that our local environmental health officers, who are really so important in all this, actually go in there and enforce and are not fobbed off. I'm not particularly confident in the local environmental health officers' work up to now. I'm looking forward to the paper coming next Thursday to Health Committee and be able to ask some more questions. But, you know, we are responsible. They have to work for us and with us. I know we have to work with them, but they have to know that, you know, this is serious. This isn't no mamby-pamby mucking about, no slap on the wrist, no please can you do it. It's you're not doing it, so that's it.
So, Councillor Hudson, I think you've made your point quite well there. Before I come to my 2 questions, actually we have an opportunity because we have Ray here, obviously, because part of enforcement is partnership working as well. And I think sometimes I see some criticism concerning the police not enforcing Ray. So, Ray, could you give us an update on the police position as far as not only outright enforcement by the police, but supporting environment officers and others in the law the way it stands at the moment?
Yes, as you know, I speak quite often with the Chief Constable, and what the police have been doing is the 4 E's. So engaging with people, explaining the situation, and then encouraging them to abide by the rules and regulations that we've got. And the last thing we want to do is to actually enforce by giving fixed penalty notices, but it will be done. And with the new regulations, the Chief Constable and I have spoken about this, and we believe that is the way that we will continue to work, because this is a health situation, and we'll work with the health people as best we can to make sure that people who are flouting the law are actually dealt with. But generally, the public have been responsive to what's been recommended, and they are really good at responding when they've been approached and things have been explained to them. Some people do forget, but as I say, it's the 4 E's for us that we are asking the force to do, and make sure that they don't actually see themselves as doing what other people should be doing. It's a combination of people that should be ensuring this. So it should be making sure that the pubs and clubs, etc., are actually enforcing their side of the law. And but the police will come in and will deal with things as and when they are required.
So thank you for that. I've got to pick you up. Obviously, a softly approach is appropriate sometimes, but sometimes a hard-nosed approach is appropriate. And you say, as a default position, the last thing that the police want to do is do fixed penalty notices. Actually, some people think it's the first thing the police should be doing, because it sets the tone and it sets an example for others, and that way others will start taking note. And at the moment, some people are saying we've got an invisible police force as far as enforcement for COVID-19 is concerned in Cambridgeshire, which I don't particularly like hearing. And I just need you to know that the police are beginning to have this reputation of not doing anything at the moment. So I don't know if you want to comment on that or take it away. So I'll leave that up to you, but I think it needs to be made in this forum.
Yeah, I mean, my position is to take things forward to the Chief Constable and to represent the community, and I have represented the community. But what the force has been saying, and which is quite right, there are things that people presume the police can do, but there is no actual legislation for them to do. But where they meet with people who are flouting the law and will not respond to the request, then they will take action. But it's that perception that people have that the police have powers where sometimes they don't. It's just recommendations. But the police are willing, they are working with all our partners to try and ensure that the regulations and recommendations are adhered to by the public. But they will actually come hard down on people where they need to see that action taken. So they will work in that way. But for me, generally the public are wanting to work within the regulations and the advice. So, and some of the people are people who would never ever become involved in law, and it's just getting used to the new regulations.
Okay, thank you for that. Well, if you do one thing, then maybe you could take a message from me to the Chief Constable to say exactly how I've outlined the perception at the moment, and I would like that to be a different perception going forward. John, you've got your hand up. Thanks, Ray, by the way. Thank you, John. John, you're on mute.
Yes, Chairman, you're on -3, by the way. I congratulate Liz on her presentation. I'll give her 9.5 out of 10 for that. That was brilliant. Thank you very much. But what I wanted to say, I support your view of the police, and that's the public's view of the police, not just in your area, but I think that's in Peterborough. But if you listen to the news last night, the councils have got to pay for wardens on the street to keep people away. You really can you really see that happening? And with my chief executive's on, I'd probably like her to comment. We've got to produce wardens around the town to make sure the distance is happening. You know, we can't afford to do what we're doing, let alone have extra cost.
Well, my chief exec's on as well, John, so we'll ask her.
Yeah, that's true.
Thank you. So we know that the COVID secure marshals are part of the proposals, and Liz and I have been talking over the last 2 days, waiting for the guidance and whether or not there's any funding that comes with that announcement. And as we speak at the moment, we honestly don't know the position. We've got a meeting later on today at 3 o'clock with the wider partnerships to not only look at the points that I think you've been making around the enforcement of the law, but also to look at the role of those COVID secure marshals and how they sit alongside that enforcement. Because the two things are, I think, from the announcement, meant to work together. So the COVID secure marshals are out there looking at compliance, and then they follow up with contact with the police who enforce. But we haven't got any detail around that as we speak, and whether it's going to be funded. If it's not going to be funded, then the expectation, I guess, it will be within our own resources, and we'll have to determine how best we're to do that. So that's the best I can say at this time. But it's as soon as we know and we get the guidance, we'll be able to give you a bit more detail around that. But that is the kind of theory of it. We're waiting now to see the practice and whether any funding then comes with it.
Chairman, Boris himself said last night that any of those costs are down to the local authorities and they can't afford to do it. It won't get done, basically.
We'll see. Well, we have that. As I say, thank you, Councillor Holditch, for that. We'll see what's actually said in practice, and then no doubt there'll be discussions with leading politicians, etc., around how we go about enforcing this. So we'll come back to you on that point.
Okay, thank you. I've got no one else that wishes to speak, so I'll come in with my 2 questions stroke observations, if I may, and try and be as succinct as possible because we are overrunning on this particular agenda item, but it is important, I think, to discuss these things. The first thing is with testing and lab results. So, Liz, if I can ask what we're doing at a local level, there's all these different anecdotes that people have to travel miles for testing and they're being sent there because there's no capacity local. And then there is capacity local for testing, but there's not capacity local for the lab to actually test and get the results back. And that's why people are being sent to other areas. There doesn't seem to be a consistency in why it's taking so long or people are being sent elsewhere. What can we possibly do or are we doing to increase local capacity for lab testing? Because I don't think the actual testing here is too limited. I think we're okay on that, or we seem to be, although there is rumours that people from out of area and out of county are using our particular testing areas. But what are we doing to actually make things on a local level much smoother and more efficient? That's my first question.
I could speak at length on that.
Please don't, because we haven't got the time, but just
okay.
I'm highlighting it, and if you could just quickly say what we might or might not be doing or wish to do on that at the moment.
So I'll make 3 key points. The first point is that this is a national issue. Pillar 2 testing at our drive-through sites and our mobile testing units is commissioned nationally. And at the moment, there has been a huge increase in demands for tests nationally, which is outstripping capacity. And the national system is prioritising areas with outbreaks, the red areas on the map, a lot of which are in other parts of the country, and ensuring that the lab capacity, this isn't the actual capacity to take a swab, it's the lab capacity to process those tests, is prioritised to areas with outbreaks, which means that areas like Cambridgeshire, which don't have an outbreak, they are cutting off the bookings quite early. So there's only a certain number of bookings allowed. That is quite correct. People are then directed to go to testing sites elsewhere in the country or whatever. And our advice is, if that's impractical, which it often is, wait and try again. Because people with symptoms of coronavirus should get a test. And our advice is wait, try again, keep going, because they're bringing new bookings on throughout the day.
Well, I'm sorry, Liz, I have to interrupt, but from my point of view, that has got to be totally unacceptable. that we're asking people to wait and try again when they've got symptoms. But so maybe you were going to come to this, but how are we going to increase the local capacity here so that our residents aren't being sent hundreds of miles away because we're not a danger area yet? But you know, if we carry on the way we are, I can see we might well be.
Okay, so we met with the CCG and the regional testing team. It was the day before yesterday to talk about how we deal with this. So we are in very active discussions about how we can increase access for some of our key workers who absolutely need to be at work to keep the system going in the public sector, such as teachers with the schools just having gone back, and whether we can make some sort of local workarounds on that with other types of testing that are available, because both the CCG and the local authority commission some testing. In the longer term, we are looking at opportunities to increase that local surge capacity if the national system doesn't have enough testing. And we're exploring we're at the early stages of exploring options on that, but I can assure you that that work is very active and we will feed back on that to you. The other thing we would ask at the moment is that if for people who haven't got symptoms of coronavirus and haven't been advised by a health professional that they need a test, so they haven't had advice that they need a test and they haven't got symptoms, we would respectfully advise those people not to go for a test, because we know that quite a high proportion of people booking a test at the moment actually may not fall into the category of having symptoms or having been advised to have a test. So it's just make sure that those tests, we're asking the public to, and Christine's doing some very good communications work around this, and Christine's team, we are putting out social media to encourage the prioritisation of the testing capacity for the people who really need it. But yeah, we're absolutely...
Thank you, we'll leave it. Go on, Liz, sorry, I interrupted you.
No, that's I was finishing, but just reassuring you that we are very actively considering how we could increase local capacity in the event of future issues where the national capacity wasn't enough.
I just really want to know that, you know, very, very soon, how we're going to cope with a surge locally, that we're not disadvantaged in Cambridgeshire and Peterborough. So my second question is about temperature testing, because I brought this up before. And if you, I mean, I think it's a good idea. I understand from you the science may not be there for temperature testing, but I think it's a really good indicator for a reminder for people behaviour-wise, if they're going into places, shops, nightclubs, anything, you know, that the virus is still out there. And it also will catch people with a temperature for whatever reason that they have a temperature, etc. I just think it's a really good idea. I'm just wondering where we have got on that. I've spoken to Gillian Beasley, Chief Exec, about it as well. I'm just wondering from your point of view where we are.
So I think it's also covered in Christine's paper, but what we're doing in public health, absolutely, having listened and understood, is we're now doing a rapid research review on how temperature testing could impact on behaviour change, because we'd looked at it from the sort of epidemiology point of view before, how many people with COVID have a temperature, because quite a few of them don't, and so on. But we're now looking at it from your perspective of the behaviour change, and how you could use having prominent temperature testings in some public venues to influence behaviour and actually get some other messages out at the same time around social distancing, hygiene and so on as sort of part of that overall venture. So that work's very actively going on in public health at the moment, and we'll be able to feed back to you on Monday or Tuesday from that review. And it's also throwing up some questions about the practicalities, which we'll come back with as well. But I think, yeah, hard work going on it, and understanding that perspective around the behaviour change rather than just the straight epidemiology.
All right, I really appreciate that and look forward to some feedback on that. We spent a lot longer on this than I intended or was meant to be allowed, but I think it's just so important. So thank you everyone for the participation in that. There's no other hands raised, so I'll move on, which is agenda item 5, which is the campaigns update. Christine Birchall, Head of Communications and Information, will introduce the report. Christine.
Hello, thank you very much. So hopefully I won't take up very much of your time. I just wanted to give you a brief update on where we were and how we are refocusing and refining the campaign to pick up the messages that we're getting for epidemiology. So you will have seen that there is a lot of information now about the rise in infections in a younger age group. So we have been looking over the last few weeks. Are you able to hear me okay? Ooh.
Yes.
Have I frozen? Oh, right, okay.
I can.
Sorry, you all froze. Oh, good, good.
I'm just so that everyone else, sorry, Christy, just so that everyone else knows, I'm getting frozen as well, but we do seem to be able to hear each other at the moment. So okay. Maybe some are suffering and some aren't.
Okie dokie, okay, I'll carry on. So we have been looking at refining the campaign work that we're doing across the whole system to look very specifically at messages for 18 to 30-year-old people. So we have a new campaign which is rolling out, which focuses on initially the key guidelines, the social distancing, the hand washing, the wearing of masks in different places. We obviously had messages which were just about to go out about where you could and couldn't meet up and how many people could meet up. But obviously that guidance changed on Thursday. So we're hastily rewriting some of those messages that you will have seen in some of the attached information that came with this paper. And we have poster work going out. We're working with all of our partners across the system to identify places where those messages can go out. And the strong message and the feedback that we've got from other campaigns targeting this age group is that we are not concentrating at the moment on death and serious illness because it is not being experienced by this group. And also large numbers of these groups do not live near their elderly relatives. So the messages which have been used quite successfully, I think, elsewhere in the country about not taking this home to your elderly relatives doesn't really play well when you've got students who aren't probably going to see their elderly relatives till Christmas. So our messages very much are about the not wanting to return to a local lockdown, not wanting to have freedoms curtailed, not wanting to get back as fast as possible to a more normal life. So those are the messages that we are promoting alongside all of the guidance around the good practice, the social media good practice. The next stage of the campaign will indeed be looking at the symptoms. And so that's the work which will start to go out from next week. And that is where in the paper I've highlighted the suggestion about the temperature checks. So we want to highlight the symptoms and people getting a test and people only getting a test when they have symptoms. So we want people to be very clear about what those are. So we are currently identifying a set of temperature thermometers, which people can use hands-free, and which we will be making, or we're suggesting that we would be able to make these available on a first serve basis to businesses. So we will buy a set that we will offer out to businesses to use as part of this rollout of the campaign, should the member-led engagement board think that that was a good part of the development of this campaign. So that's one of the asks for you. So what I wanted to ask you today was to have a look at the harder hitting campaign. We have a number of other things designed to catch people's attention. We've been working very closely with the universities, with Anglia Ruskin, with Cambridge University, but also with other advocates in young people. So we're not just concentrating on students. We are working with the Cambridge University boat race team to record some messages. We're working with actors who appear in things like Game of Thrones and reality stars from things like Love Island. So people who this age group in particular will link with, and then we are working with a whole range of organisations who will be putting these sorts of messages from us out to social media in a way which is very shareable for this particular age group, so that we can really target age group. We were talking yesterday to Cambridge University about particularly targeting the social media messages around Tuesdays and Fridays, which are nights when traditionally the students are out and about in the city. We're talking to taxi drivers about putting information in the back of cabs. And we are talking very closely with all our environmental health colleagues about any other materials that we could use to support them. So the ask today for the committee is to look at this slightly harder hitting campaign and give your views on it. to approve, we already have some budget for materials from the Test and Trace grant, and to approve this idea of making a set of hands-free thermometers available on a first come first serve basis for local businesses as part of the second bit of the rollout of this campaign, and to suggest any other ways that you as members can think of this member-led engagement board can think about how we might roll these campaigns out, further advocates, and any other steps that you've got, any other suggestions you have about local community leaders who might be, we could get involved in this work.
Okay, thank you, Christine. Just before we go on, can I ask Nick Mills, is everyone still on the call? And the reason I'm asking is that I've got frozen screens in front of me. That may not be the same for any or everyone else. I can see a couple of hands that have gone up, so obviously people are still on the call. But Nick, is it okay, or is it just me?
Everything for me seems to be perfect, so I don't know if it's your connection or not. Right?
Yeah, I got an unstable connection coming up, so I think it is just my end. So I'll do my best. It's just come up again to say it's unstable. I'll do my best, and hopefully I'll stay in the meeting. So I'll move on. Thank you, Christine, for that. Peter Hudson.
Roger, I'm happy to give way to Liz if she wants to speak first.
Liz? Hi, Liz.
Sorry, I'm having difficulties unmuting. Yeah, it was. Oh. Am I off mute now? Okay. Yes, it was just a point in support of Christine. It was to talk about giving the thermometers or the temperature check equipment to businesses. One of the things that the piece of work that we're doing has thrown up is that actually there are some, it's like anything, there are some potential risks that just need to be thought about in terms of managing the queues, in terms of how can you promote the other messages at the same time. In terms of what does someone do if you find they've got a temperature and they say, but I came here by bus, how do I get home, what do I do? That we kind of, I think, well, there's a bit that needs to be behind the giving the equipment to businesses in terms of sort of a bit of help with those issues in advance and assurance that they're going to use that equipment in those ways. So I would say, you know, if board wants to go ahead with this, and that's fine, but I would just put in sort of with those provisos around the businesses we're working with, if that's okay. I don't know if Christine wants to respond on that.
Okay.
We'll work very closely with public health to make sure that everything that we do absolutely, but we just thought it would be an interesting way. It may be that we target a specific set of businesses where we can actually make this work, or maybe nightclubs, or, you know, maybe pubs and restaurants, or maybe something else, maybe shopping centres where we've got security people who could help and support that. But we'll work really closely with public health if you thought it was a good idea to make sure that we can make it work.
Thanks, Christine. Peter.
Thanks, Roger. I've got a few things to add, if you don't mind. I'm sorry if I'm going on a bit, but this is really important. We've got to get it right. Regarding the campaign, Christine, as ever, it's great. I got the paper a couple of days ago, I think, and I've been reading it. And I'd just like to tell you about a group of people I spoke to yesterday evening in Peterborough, actually, strangely enough. About 23 people, socially distanced, all very legal. And we were talking about general public health and COVID and that sort of thing. And I went through talking about the campaign you sent us, Christine, and the response I got almost left me sort of speechless, which just, as you know, doesn't happen very often. You know, I'm doing it for you, do it for me. NHS picture, we know. We see it, we ignore it. We already know it, we've clapped. Don't walk too close to me. And then they accuse me of, you're trying to frighten us. We can walk close. You normally walk sort of 1 metre plus between people anyway. We don't always, everyone doesn't hold hands. That threw me. Wash your hands, we know. the picture about the 1918, which I really like personally. They were once returned to a lockdown. They didn't think it was inspiring. I do. And then, yeah, FaceTime, yes. Face-to-face time, no. And they really took offence to that, because everybody wants some form of face-to-face time for their mental stability, if nothing else. You know, if we have to stand, this is them, not me. If we have to stand 2 meters away from each other and have a chat, I mean, that's nothing we don't do anyway. And, you know, and if we get too close, so 1 meter plus, you put a mask on, we can still talk. We don't have to face each other. We can stand near, but face away from each other and still talk. So I was trying to push what you wanted to push. I thought it would be really good to try this out. And I stood there and I went, what do I do now? So I just had a brainstorm, and I changed tack completely. And then I went on the tack of, actually, you can have a life as near normal as you possibly can, whilst complying and following the public health and government guidelines. So I went, you need one of these, you need this. I have this in my pocket all the time, in my car, where whatever I'm doing, I'm frequently doing this to my hands, even when I don't need to. Businesses, I visited a business recently, which I'll tell you about in a moment. These thermometers take I don't know what, a minute, yeah, between £2 and £3.50. Very accurate, I'm told. I don't know. And then I explained how I live my life and how I want to live my life with COVID restrictions. And I said, when I go shopping, I'll be walking up in Cambridge, and I have my mask, and you know, if there's too many people, I just put my mask on and just think. 3 things: mask, hand gel, common sense. I go to Boots Chemist, yeah. I've got to always do this before I go into a building. I go to the building with a mask on, I do my shopping, have a chat to the very nice person behind the till, and I come out. As soon as I come out of the shop, I do this. If I need to, get on with my life. I go see my friends. We're in the garden, we're in their houses. We can't do more than 6 now, I get that. But even then, I had people in my house the other weekend, and I had 6 of us, and we could sit on my sofas and my chairs with at least 1.4 meters between us, because I took a tape measure out. And then we spent most of the time in the garden. This was in the house. Every time
Peter,
they entered.
Peter,
yeah, I
Peter,
know.
sorry, can I interrupt? You're making some really good points, but we're running out of time.
Yeah, the point is, I suppose the point is really, before I go on to the business I visited, are we frightening people too much? Should we be going on unattacked? Yeah, if you follow these guidelines, you can live a near normal life. It isn't difficult, it's simple, and it's not frightening. We don't have to frighten people to keep them alive. We just have to persuade them psychologically to follow the guidelines. That's it, Roger.
Okay, thank you. No, it's just we've only got 2 minutes left of the official time, so I don't know if anyone wants to come back on that, Liz or Christine. I'm still really struggling with frozen screens here, but please.
Just to say that we will be doing lots more engagement with young people to change the message. So these won't be the messages for everything, but the imperative was people are not following these guidelines, and this is what is leading to the sharp increase. And we wanted to do something that was quite hard hitting, and that did remind people quite starkly. This isn't the only thing we're going to do, and we are going to be refining the messages. The FaceTime, face-to-face time one, we are not doing at the moment because of the changing guidelines. So I'll take on board all of your comments, Councillor Hudson, but we are working with young people on refining the messages, and there will be more of them. So I think the first ones are a bit stark because the rise has been a bit stark, and we need to do something quite, hard hitting, and that was the ask.
Okay, thank you. I say we are running out of time, but I've got no other hands up, so thank you. Peter, you've made some good points there, so thank you for that. But we've got some recommendations here from Christine, and they're in the agenda packets. There's 3 recommendations, and we've talked about others as well. Does anyone have a problem? So if you have a problem with those recommendations, please raise your hand. Oh, Peter. You're on mute, Peter.
Sorry, I'm just scratching through to find the recommendations. Oh, there it is. Sorry.
It's basically what we've been speaking about and Christine spoke about at the beginning.
The only, I don't think we should give thermometers to businesses. I visited the business. They had things they put on your forehead or could see it. They had loads of these. Their workforce, about 40 people, came in and out, and it took a matter of 15 minutes to get all their temperatures done. And if one business could do it, they all can do it. They all need to be back to work and competing, and it's easy.
So what you're saying is thermometer, if we're giving thermometers out, maybe it shouldn't be a priority to business. That's your opinion. We could be using it elsewhere, but
well,
yeah.
if we need to give them away, I don't like giving them away, but there perhaps might be other priorities other than businesses.
Understood.
Yeah.
Understood. So I'm just trying to cut people short because of the time. And Val, I know, could you make it very, very quick, Val?
Yeah. I got the impression the businesses you were thinking of targeting for thermometers were ones where the age group particular of concern now would be congregating rather than workplaces as such. That's what I took from that, and I'm supportive of the plans if the wraparound support can be achieved to make it effective and safe for people.
No, fair enough. I think there's good points made on all sides here, and Christine's nodding, so thank you. So I haven't had anyone that actually specifically says no, Christine. So please, you have the recommendations here of this board to move ahead, and just keep us informed, obviously, of what you're doing. That would be great. Thank you. Okay, just moving on. Agenda item 6 is public questions. We've received no public questions on this occasion. And just to say the date of the next meeting, the board will next meet on Monday, the 5th of October at 11 a.m. So thank you very much.
Roger,
you've got your hand up.
Yeah, just very quickly. This local outbreak engagement board is the political leadership of all the great work our guys are doing in both Cambridgeshire and Peterborough. We have to work, unlike Peterborough, who are lucky, I suppose, we have to work with our district councils, and we need to work with them and support them, and they support us. There is a district representative supposed to be here. South Cambs put their hands up. We have never had, since we've started, a representative from South Cambs District Council. Can we please go out to East Cambs, Fenland or Hunts to say, can you supply a rep so we can 100% do our job? At the minute, the districts are not being briefed by the district council who should be here. And I think we should replace that person with a person who will be here and who will do the job they're supposed to do. Thank you.
No, I think that's a good point, Peter. Thank you for bringing it up. Liz, could you work with Democratic Services so that we can send a letter primarily to South Cambs to find out what's happening? And if we get an answer that no one's going to represent the districts, then we have to go and find another district representative. Can we do that, please, as an action immediately? Thank you. I'm getting a nod. Thank you, Peter. All right, on that basis, thank you, everyone. Slightly over, apologies, but I think it was well worth the discussions and the points. I declare this meeting closed. Thank you.